First off this evening, before we have the speakers, we would like to share with you a video from the Fertility Education Initiative.
Fertility? Who thinks about having kids when you're at school? The thing is, what you do to yourself now affects your future health and fertility. Take Fliss and Louie. They haven't even met yet, but one day they'll get together and want to start a family. They can't see into the future, so they don't know that they'll struggle. Right now though, Fliss has just had a one-night stand. The condom split in the middle of sex, and she's worried. She was technically still on her period. Well, still spotting anyway. You can't get pregnant on your period, right? Turns out you can. The fertile window is basically the few days every month when it's possible to get pregnant. And for humans, that's around 6 days, usually around the middle of your monthly cycle. Girls have 24 hours once an egg is released from the ovary for it to be fertilised by a sperm cell before the egg starts to break down. Sperm can survive for around 5 days inside a girl's body, so that's where the 6 days comes from. 6 days of what's usually about a 28-day cycle. So, depending on how long your period lasts, and when you ovulate, in other words when the egg is released, yes, it's technically possible to get pregnant when you're on. Because the monthly cycle and ovulation can change from month to month when you're young, you have to assume you can get pregnant at any time and be really strict about contraception, or you might get caught out. So, understanding your body is a skill for life. For now, when you don't want to get pregnant, and for later, when you might. If you do want to have kids, knowing your fertile window is important as it gets harder to get pregnant as you get older. Girls are born with a fixed number of eggs that are continuously lost over time as you get older. So, the number of eggs and also the quality goes down as you age. That's why the main thing that affects your fertility is age. And after you're 35, fertility starts to decline fast, though sometimes things can go wrong sooner. Smoking makes you lose your eggs more quickly, for instance, and having a bad diet or being overweight can affect egg quality. Because eggs are in your body for life, having an unhealthy lifestyle will affect them over time, and your teenage years are really important. Louie isn't off the hook either, even though sperm is being freshly produced in the testes all the time. As smoking, cannabis, being inactive, junk food, and alcohol can all affect sperm health too. So, by the time Fliss and Louie meet years later, all these things they don't notice having an effect now build up over time to cause big problems. Plus, they don't realise that waiting 5 years before trying for kids might mean that they'll leave it a bit too late. One day, they'll be in a fertility clinic, wishing someone had taught them this stuff at school.
It gives me now great pleasure to introduce our first speaker, Professor Adam Balen.
Thank you very much, Sarah, and thank you to Progress for hosting this evening and for keeping the flag flying for fertility education, which is really important. You've been there from the start, and we really appreciate the support that you've given. So I just have a few minutes now to introduce this subject. As already been highlighted, it's really important that young people are fully aware about all aspects of their reproductive health and factors that can affect their future fertility, which was beautifully encapsulated in that animation that was the first of 2 animations that we put together in the Fertility Education Initiative. And so The real issue is, where are we going with all of this, and how do we get the message out further? And I'm delighted that in Scotland that animation is being shared and more is being discussed in schools. So there are a few simple facts that you'll all be familiar with, but quite sort of stark, really, that 20% of women born in recent years end their reproductive life without having had a child, sometimes through choice, but often not through choice, because they find that they may have reduced fertility. And this is twice the rate in their mother's generation. This is often because uh, women are leaving it later to try to start for a family, and we've seen this demographic shift whereby women are having their first child much older than they were just a generation ago. And at least a fifth of couples take longer than they would like to achieve a family. And whilst we've made huge strides in the field of reproductive medicine, and of course, IVF started here in the UK some 40 years or so ago, unfortunately, assisted conception technologies such as IVF don't always work for everybody, and their success is um, affected by age. So why are young people leaving it later? There are a number of complex reasons. We know that it's difficult to start a career, to leave home, and there's definitely a socio-economic disadvantage for young women who start a family compared with those who leave it. Um, there's also been shown to be a lack of commitment by young men as well. And I think also important in the current time is what are going to be the after effects of the COVID pandemic. And I'm sure this is going to have additional influence on this. There are also many mixed messages out there. Um, IVF works for many people, and there are many high-profile celebrities who've achieved pregnancies, sometimes at an older age, but often with donated eggs, which may not have been talked about. And also there's a lot of publicity about the potential for freezing your eggs, but it's not available on the NHS. It's a invasive process. It doesn't work for everybody. And so it's, I think, a misplaced insurance for the future. It may have a role, but again, it would be wrong to think that it is the answer for everybody. Far from it, in fact. And as Sarah mentioned in her introduction, there's a big variation in the deliverance of relationship and sex education in schools. And whilst, of course, there's been an imperative to educate young people about safe sex, consent, and contraception, we also feel very strongly that young people need to be empowered with the knowledge about all aspects of their reproductive health that may affect their ability to have a family in the future when the time is right. When we started the Fertility Education Initiative, we did a survey of young people, and we found huge inconsistencies in knowledge amongst young people about all of the factors that affect their fertility. Time doesn't allow me to present the data from that, but it was certainly a very interesting survey at the time, and other studies have illustrated similarly these huge gaps in young people. And as illustrated in that animation, when couples come to fertility clinics, it's very common that they express surprise that they may have left it too late. So that's why when I was chair of the British Fertility Society, we decided to found the Fertility Education Initiative. This is a collaborative venture, and it's been a great project. And I have to acknowledge Joyce Harper from UCH in London and Jackie Boivin from Cardiff, who really have been leading the way as well, together with myself, in trying to get this on the map. Our vision being to ensure that people have a greater understanding and awareness of fertility and reproductive health so that they can make an informed choice about their fertility journey. And this has been a collaborative effort with a number of organizations that I've listed here on this slide. And we had our initial summit back in 2016. And the aim has been to produce educational resources, which you've seen one of our animations. And these are designed to cover full understanding of human fertility, the reproductive life cycle, both fertility and infertility, and planning for a healthy pregnancy. Understanding the big variations that there are in modern families, which was our second animation, and different routes to parenthood that I've listed here that you'll be familiar with, such as the need to ensure that everybody has an ability to understand how they might be able to have their family in their way when the time is right for them, and the various routes to parenthood that they may be able to follow. And also to ensure that young people are aware about what's available, the different reproductive technologies, what they can achieve, what they can't do. And this, of course, again, informs those who want to start families in the big range of ways, whether it's with donor sperm, donor eggs, surrogacy, or whatever. So in our fertility education initiative animations, the first you've just seen, the second, Fertility Technologies Shaping Modern Families, and I've put the YouTube link here, we cover all of the different ways in which young people might be able to found a family if they are from LGBTQ plus communities or if they have disabilities, and the various technologies that are available. On our website also, we've got some simple fact sheets that were designed by Jackie, and you can see these on the British Fertility Society website under the Fertility Education Initiative. We were also very successful, and I think this has been our greatest achievement, in ensuring that facts about reproductive health, including fertility and the potential impact of lifestyle on fertility for men and women, has been included in the new guidance on relationship and sex education produced by the Department for Education. And this now is coming into play. And of course, it's our responsibility to ensure that appropriate educational material is provided to teachers and young people so that this aspect of the guidance is followed. And whilst the bulk of the guidance deals with general health and well-being, um, uh, there's also reference to understanding the various forms of sexuality and sexual relationships and modern ways of founding families, which, as I said, is covered in our second animation. And so I think it's been a great achievement that we've actually been able to get this on the national curriculum, which I think really now lays the door open for us to ensure that the educational material is now appropriately delivered. And of course, we have to ensure that we're delivering age-appropriate information and ensuring that the right topics are discussed at the right time in a young person's education. We've also been participating in a global campaign led by Joyce Harper, and this poster here, and I appreciate you can't read the text, but the point is that um, this has been translated into about 30 different languages, and this is a global collaboration to try and get fertility education on the map with simple messages distilled from the more detailed information that we have in the Fertility Education Initiative um, documents. So that's just a very brief overview of what we've done in the last 4 years, where we've got to, and a glimpse into the future with a vision to ensure that we really do make sure that the guidance in the national curriculum is followed. And I'd just like to close by acknowledging some of the key players and a photo here from a meeting we had in London a short while ago, some of the key players and organisations that have been involved in the Fertility Education Initiative. Thank you very much.
Sharon is the branch coordinator at Fertility Network UK, and she is the leader of Your Future Fertility Education Programme.
My name's Sharon Martin, and as Sarah said, I'm the Scotland coordinator for Fertility Network Scotland. What do young people need to know? So what we do is we talk to young people. We talk to them about sexually transmitted infections. We talk to them about the impact of those sexually transmitted infections. We don't go in and lecture them about not to be having sexual intercourse. We talk to them about the risks if they have unprotected sex, or if, as Adam mentioned, or Sarah mentioned, if they have unprotected sex, get that sexually transmitted infection checked to ensure that they didn't get one, and if they did, get the proper medication to ensure it's cleared. We talk to them about weight. This is really, really important, particularly in our world in fertility and dealing with patients every day. A huge concern that we have in Fertility Network is the number of patients that come to us 35 onwards who are now starting a fertility journey, who didn't know that one, weight is a huge risk factor to pregnancy, but also you can't access fertility services on the NHS if your BMI is over 30. And this is a huge issue even today with patients who've got BMIs well above 40, and the clock is ticking with those patients. So even just having that engagement with young people about how important it is, one, to be healthy, but secondly, you don't know what the future holds in a fertility journey for you, and it's something you need to actually even start thinking about before you actually embark on trying to conceive. We talk to them about smoking, the risk factors, the impact it has on egg quality and sperm quality. We talk to them about excess and binge drinking, and this is a really big one because that links back to the sexually transmitted infections, because most unprotected sexual encounters occur usually as a result of excess drinking with our students. We talk to them about eating disorders. Once again, that can cause periods to stop in girls, and of course the BMI restrictions for accessing fertility services also occur at the lower end of the BMIs as well. Anabolic steroids, now this is a growing concern. I've spoken to a number of urologists who are getting more and more concerned about the male use in anabolic steroids, and from someone like myself that's in and about universities and college, this is something that's getting used more and more with young people, and I talk to them about the absolute risk of that on their fertility. Of course, recreational drugs we talk to them about, and as Adam mentioned, ageism is a huge factor as people are leaving having a family until they're much older now, and therefore that window of opportunity is much reduced. We also talk to girls about periods and what's normal and what's not normal. There's so many people who don't know that potentially they might have PCO or PCOS, and some of that can actually be identified through their irregular cycles, and we tell them don't wait till you're in your mid-30s to actually get that investigative work done. Go to your GP, because that irregular cycle actually might mean more than what you actually think it means. So that's what we do. And how do we do that? So last year we attended freshers in 45 colleges and universities across Scotland, from Aberdeen to Dumfries. That's no mean feat, because if anyone knows what freshers is like, it takes place over a kind of very short window, around 2 weeks. We've got 3 staff on it, and we could be jumping about from college to universities, crisscrossing all over Scotland to speak to young people. It's absolutely amazing fun. When we go into the colleges and universities, we don't just stand there at our stalls. We've got games and different things with us to engage with young people. And if you've ever been to any of our events, You will see we're probably one of the busiest stands in a freshers event, and there is lots of other ones there to attract young people. But I think some of the games, and we've got freebies and different things that we can give away to young people, it works really, really well for us, and it's every year. It's just getting bigger and better in colleges and universities. Last year we were at one event and there was 12,000 students came right across our door and right in front of our stand. Now we just don't have the capacity just to speak to everybody at the same time, but we've got leaflets and freebies and everything all getting taken away from our stand, and where possible we're actually engaging right with these young people and talking to them. The other thing we do is we go into the universities and colleges and we talk to student nurses, we deliver presentations, we talk to them about not only your future fertility, but the work the wider charity does. And that's a fabulous opportunity for us to actually sow that seed with both our midwifery students, but also our mental health students. And lots of them, and the feedback we get, they tell us it's really worthwhile. We engage with our health and wellbeing students, we deliver presentations to them, and that includes our sports science students, and that's where we came across quite often, you know, the lack of understanding around anabolic steroid use. We talk to our GPs and our community link workers. Community link workers in Scotland are a fabulous resource that we have in Scotland. They're great in terms of they work in the GP surgeries, and quite often the GPs use the community link workers to reach the harder and more vulnerable young people. So we're able to actually have conversations with the community link workers, and when they've got concerns about young people and messaging that they need to get in relation to the lifestyle choices they're making just now, we can interact with them. We also work together with sexual health practitioners who've got a really important role in the community and working with young people, whether that's dealing with STIs or pregnancy or anything. We'll talk to them, and they talk about us to their patients they're dealing with, and that allows that link between, you know, the vulnerable young people and fertility education. We also work with loads of community groups, third sector organisations, and we run workshops for them, and that's really useful to enable us to reach the young people that are not in education. I should mention everything we do in colleges and universities, so we're reaching from 15 and up. You'll find in colleges there's quite a significant number of young people now. A lot of young people who are in school are also part-time in colleges as well. So we're managing to reach down into our 15-year-olds and onwards. So what do young people tell us? This is really important, and this is something that we ask young people. So every year when we're doing our freshers and we're in colleges, universities, we ask young people, what do they think impacts their future fertility? And these figures I've put up here are quite stark, and probably even for some of you listening, you'll be quite surprised actually how little some young people know. So before they attend the stall, we'll ask them, as they attend the stall, we'll then say, before you came here, what did you think was the kind of main things that could impact your future fertility? And you'll see still smoking's the top answer. You know, we've done a fabulous job in educating young people on the risks of smoking, and that's still really obvious in our surveys. It's still the #1 reason that young people will give us. But you'll see age, which is a massive factor in our world. There's only 3.7% of people that answer our survey recognise age as a factor in impacting their future fertility. Alcohol is another biggie. So you'll see smoking and alcohol are the two biggies, and the ones we want to really try and push on with them is the STIs, age, anabolic steroid use. The great thing is, with the young people that actually complete our surveys, is 95%. Now we had over 2,348 surveys completed, and of that, 2,227 young people that answered our surveys said they would give their future fertility now more consideration. And to me, from a charity's perspective, our education programme's perspective, if we can make that small difference, just be out there and engaging with young people, and I think that's going some way to educate young people. It's not an easy task just trying to engage with this age group, because lots of the messaging we're trying to give them, they're in students in halls and they're having just the best time of their life. We're talking about excess alcohol, we're talking about unprotected sex, but the way we try to put the messaging over is in a really fun way with the games we play with them. We line up all different, from a beer glass to a shot glass. We've got a bottle of vodka filled with water, and we ask the youngsters, come on, show me what a pub measure looks like. And the fun that generates and the conversations we can have with young people at the same time, just that chunk of a message that we can leave with young people works really well for us. And we get, last year we had 720 males approaching us that filled out a survey. We had 1,500 odd females, we had 38 non-binary students, and we had 10 others. So we're engaging with all of the students and we're getting all of our messages across. Education during our COVID has been a bit different. We haven't been able to get out this year. There was one Freshers event in Edinburgh in early September. It was a really limited event with very few stalls at it, and it was done in a really safe way. But the rest of our events have been done. We've done university Facebook Live events. We've done Q&As with students. We've done digital Freshers events. Some of the universities were set up really well and had managed to get a digital Freshers event going. One of our new programmes that we've started is our student ambassadors. They've now set up with us, and we've got student ambassadors in our universities, and they're carrying on our messages. We've got video messaging clips that we're putting out. We've been running competitions and QR codes. We're partnering with the Sexual and Youth Health in Scotland. We've started our own TikTok. We're using influencers. So you'll see that the charities managed to move with COVID and with the times. And you'll see we get absolutely fantastic feedback from our students across the board. And finally, I'd just like to thank the Scottish Government, our NHS, our education partners, because without them, this wouldn't be possible. Thank you.
Our final speaker is Anna Shams-Illy, and Anna is a communications director at Sexpression.
Sexpression UK is a national charity with the aim of empowering young people to make more informed decisions about their sexual health and relationships. And we do this mainly by delivering inclusive and comprehensive relationships, sex and health education, or RSHE, to young people across the UK. And we also run advocacy campaigns. So Sexpression was started around 20 years ago and set up by medical students, but we have since then grown immensely. We are completely run by volunteers, which is why I'm also a student. And this makes our facilitators closer in age to the students they are teaching than if they would receive RSHE from, say, their teacher. And there's research that also shows that young people do prefer receiving RSHE from someone similar to the age, and that's what we were able to do. Our workshops are interactive and free, which makes good RSHE more accessible to schools who might not otherwise have the funds. And that's something that's really close to our hearts, that we want to make RSHE available to everyone. So our primary activity is our teaching, and all these stats here are from our impact report from the last academic year. This was created by our Child Protection Director, Eva Zilber. We train students across the UK at our university branches, and last academic year we had 650 trained branch volunteers. So that year, most of our teaching was to 13 to 16-year-olds, and we had 8,925 sessions in total across all branches. We don't pick our own topics, but we have a core curriculum, which you can see on our website, and teachers then ask us to lead specific sessions. And this can also be from youth club leaders. The most popular topic we taught last academic year was safer sex and contraception, with the topics consent and then relationships and abuse following. And these tend to be the most popular ones across all years. So again, besides our teaching activity, we run campaigns both on our own and with organizations that align with our values. So recently we've run a social media campaign with Brooke. This was focused on providing university students information about how to access sexual health clinics during the lockdown, and especially because a lot of students didn't realize they could still access sexual health clinics, it was more of a call to students to still get tested even during the lockdown. Of course, this depends on local restrictions, but so we created a campaign with Brooke through these graphics that I've shown here, kind of trying to urge them to do this. And earlier this semester, we also ran a successful online sexual health week. This included Instagram takeovers from organizations such as the LGBT Foundation and Simon Community Scotland. And in the past, we've also had projects like our LGBT plus dictionary for more inclusive classrooms. This was aimed at educators who might not be acquainted with the vocabulary to talk about LGBTQ plus topics. So we also do work with teachers to create resources that they can use independently in their classrooms. So in Scotland, we have 5 branches at universities in Aberdeen, Dundee, Edinburgh, Glasgow, and St Andrews. So besides my role at the National Committee, I'm also the training officer at Glasgow. As training officer, I train our volunteers to go out to teach, and we mainly teach in youth clubs in the Glasgow area. So together, all of these Scottish branches, we sometimes work on Scottish-specific advocacy projects. And we're also right now working on hosting the Scottish Conference in February 2021. And this will be a bit like the national Sexpression conferences, but only inviting Scottish speakers and trying to keep everything in a Scottish perspective, as there can be quite a big difference between teaching RSHE in Scotland and England, for example. So Sexpression and fertility education. I really enjoyed the first animation that was shown here because I think it really kind of aligns with the values of Sexpression, of how we see fertility education. So we believe that it starts with the solid basis of RSHE, and we want to help young people understand and take charge of their sexual and reproductive health. And I think that's also what the video was kind of talking about, of when you have a better understanding of your body, you're more inclined to make better decisions overall. So we have more direct lessons on pregnancy, for example, and in our bodily changes topic, we get into a lot more that's very specific to fertility, but it's not as frequently taught as other topics. It's not something that teachers tend to prioritize. But even then, lessons outside pregnancy education also relate to fertility. They promote an understanding of the body, and they promote an understanding of the relationships that you have with other people. And we also believe that our teaching gives young people a vocabulary to talk about their sexual and reproductive health. So we want to help destigmatize the conversations. They're not something that young people always will have. And oftentimes when we come into a classroom, it might be the first time they really have casual conversations with each other about their sexual health. So this all lays the groundwork of understanding fertility, and it prepares them to make more informed decisions later in life. So we think it's a more holistic approach. So it's meant to help young people understand how their sexual and reproductive health and their relationships, how it all works together. So this strong basis of comprehensive sex education is important because you can also frequently meet this attitude in classrooms. I think it was mentioned earlier as well, that young people don't understand why they have to learn about something. They want to know what the practical, like right now, reason is for them to learn something. And by having this kind of understanding that everything is connected, they understand how their decisions now can affect choices later. And also it promotes an interest in their own sexual and reproductive health. So to name some more concrete examples where fertility comes up with us, in our teaching of safer sex and contraception, we, amongst other things, talk about long-acting reversible contraception, and we help students gain an understanding of what contraception would be suitable for them and how there for some might be time before the fertility returns. There are a lot of misconceptions you read about contraception in the classroom. I think the one that I've seen most frequently personally has been thinking that it will have a very adverse negative effects, like exaggerating the effects of contraceptives. Some people think that contraceptives work the same as an abortion pill. So they think that if they have an unwanted pregnancy, they can simply take contraceptives, which can work in very rare cases, but generally not. Then in general, there's also a lack of knowledge about non-hormonal birth control and understanding the differences between that and hormonal birth control. The same goes for emergency contraception, which is probably one of the most misunderstood ones. Again, it's very frequently confused with an abortion pill, or it's thought to have long-lasting effects on fertility, such as a lot of people I've met have generally thought that if you take one, you cannot get pregnant afterwards. So contraception will play a part in many young people's lives and is one of the big steps to improve knowledge about fertility. We also teach and discuss family relationships. We promote an understanding of other structures than the nuclear family of a heterosexual mom and dad. And it's important to us that fertility education is not just about a cis man and woman wanting to have a child, but it encompasses the range of experiences people might encounter. And this could include single parent households or families seeking IVF treatment due to difficulties with fertility. It just includes a lot of things that aren't always shown in mainstream media, which is where a lot of young people get their main education from. So inclusivity is one of our core beliefs, and it's important for everyone to understand the different ways relations can form. If our teaching isn't inclusive, what we're doing is alienating young people and making them feel that this is not a topic for them, which again will decrease their interest in seeking out other information about sexual and reproductive health. So outside this direct approach to teaching, we also provide a lot of information on our social media, and we have a really big user base there. It's primarily university students, but we also do see a lot of users who are going into university or in secondary school. So here we can aim at an older audience, and we can also expand on topics. So as I mentioned in the beginning, we don't pick our own topics, and we're usually given an hour slot. This is not a lot of time to go through everything. So it's quite nice to have this other platform where we can expand, and we also do refer students to our social media. So this could, for example, include information about conditions like endometriosis, which is a really big one at the moment. There's like not a lot of awareness about it. I think a lot of it is starting to come, but it's still very much contained to sexual health spaces. And it's something that we're also trying to include more on in our classes and currently working on our lesson plans. So our advocacy director, Amy, is also currently working on a project of resources for RSHE past secondary school. And we just completed preliminary research for this amongst our social media followers. So again, the ones who are mainly answering were university students and recent graduates. And here we found out that many felt they didn't have good enough RSHE in schools. Some had no RSHE in schools, and there was a general want for more information, although for the latter, there's quite a confirmation bias. So since this project is under development, of course, we can't provide specific details just yet because we're still working on it. But our aim with it is that it will enable access for people to continue their sex education with topics that are more relevant to them now, and for our branches to be able to teach university students as well, as we have found that your RSHE cannot stop at secondary school. Most people don't receive enough RSHE. Even teachers who try to include it are not always able to include it as much as they would want to. So to conclude, our core belief is that comprehensive and inclusive RSHE at a young age will help prepare young people to make more informed decisions, both in the weeks and the years after. So what we would like to see is schools in general embracing a wider curriculum of RSHE, as well as dedicating more time to this. And that can be with Sexpression or outside of it. But in general, we meet that teachers expect quite a lot from very short time slots. And it's important to understand that RSHE is not like, I don't think any topic in school should be seen as that way, but there's this kind of thinking that you can do it once and then students will remember it, but it doesn't need to be something very continuous. So it can also include evidence of contraception, family structures, endometriosis, and so on when you dedicate more time to it. We can't leave it to the individual students to get that information because we know this widens inequalities. We've seen that in a lot of research, that especially in dimensions such as class and ethnicity, a lot of students are more reliant on getting their RSHE from schools. So leaving it up to individual students to seek out information by themselves is not going to work, and it will just leave some students a lot less informed than others. So this is in general, our approach to fertility education. Thank you.
Ganesh is curious to know how you engage with males, as it seems to me, she says, that they're the hardest audience to engage with. So I think as Adam is a male, perhaps we should go to him first to see if he's got any insight into that, and then we'll go to Anna and then Sharon.
I think it's an extremely good question and absolutely spot on. In the survey that we found that young men knew less about fertility, were less engaged. And I think it's really important. So you have to try and make the information engaging, which is why we obviously included young men in our animation. And I think if you try and find a route through that will interest them and engage them, I think that's the way. And you need to have sort of catchy one-liners and sort of brief messages. I mean, one of the things I'd love to be able to do, it just in the way that you have health warnings on cigarette packets, put healthy warnings on condom packets, that sort of thing. There may be ways that you can grab the attention of young men, and you have to perhaps be a little bit imaginative as well, and trying to bring young people together, so that they can all be engaged in the conversation. It's actually surprising how much they want to know if you can actually get them in the right environment and start talking and get the discussion going. I'm sure Anna's probably found that with Sexpression as well, because I think the work that Sexpression does is tremendous, and it's the peer-to-peer engagement that I think is really key here.
So Anna, do you want to follow on from that? How do we engage with these young lads, young gentlemen?
Yes, I'd like to. Oh, I have so many thoughts on this. I have to just order them. So I think it's true when you go into a classroom that men actually do engage if you give them a chance to. So what we try to do is create interactive workshops. And once you actually get into it, I don't think there's at least what I've seen, I don't think there's like a specific gender that is more inclined to engage with discussions. Everyone is quite interested. When you give them the chance to be engaged in it. It's really an interesting question because it's something we talk about a lot. So as communications director, I work a lot with a social media team, and I'm responsible for all our campaigning there. And of course, look a lot on our analytics, and we definitely have a much bigger audience of women. And I think it's something that's very, just you see it in general in the sexual health movement. It's something that has been kind of claimed a lot by women. And I think it also is just because it's connected a lot to feminist movements, for example. So I think there's some historical kind of reasoning as well there. With Sexpression Glasgow, I actually recently made a campaign for International Men's Day, where I interviewed 6 men about kind of their feelings and just thoughts about sexual health and different things. So everyone was in couples, like in friend couples, and they were asking each other and just having like a friendly chat about it. And it was really interesting to me, first of all, how difficult it was to get men to be willing to talk about this. I have a fair amount of male friends. No one wanted to participate in this video. And then I also asked about how often do you think about contraception? And there was, of course, it's very non-representative, but I thought it was quite interesting how a lot of them were thinking, well, I don't really think that much about it because I have a girlfriend, or it's the other person's responsibility, or I don't really think about it that much. So I think it is like something we see quite a bit, and I think it definitely comes from this understanding, which I was trying to say earlier as well, that some groups don't think it is their knowledge to have or relevant for them. So I think it's about doing that. But that campaign was quite successful and actually engaged a lot of men. So I think it's some more direct messaging, definitely.
So Sharon, I'll come to you now for how do we engage with them?
From our charity's perspective, what we've found works best is actually going to young men, and what we do is we target colleges in particular where there's a high number of male students. You'll find like in Rosyth College, engineering type colleges are predominantly male. City College at Riverside in Glasgow is predominantly male. Some of the Kelvin colleges, and there's 4 campuses in Glasgow, some of them are pretty much male dominated just because of the subjects that are in those colleges. Where you'll find in universities it's a much more even split. When you go out into the colleges, you'll find that there's some of them that are pretty high in the number of males versus females. So we try to ensure that we take a right balance of educational establishments that we actually go to. And by doing that, we managed to engage quite a significant number of male students. And you know, we actually have the best fun actually with some of the male students, because you know, we have a bucket in front of a stand, we play games, you know, the alcohol goggles that you get them to put on, we get them to put that on, and then they have a competition amongst themselves. We've got some wee furry sperm and they throw it in the bucket with the goggles on, and it gets, you know, boys are so competitive.
Well, 2 questions related to endometriosis, one from Anne-Marie Singh and one from Ariana D'Angelo. So I think I might put them both together a bit for you. And I think, Anna, as you raised endometriosis in your presentation, perhaps we'll go to you first. So, Mary-Anne says, I'm wondering what you think needs to be implemented for young women to be more aware of endometriosis symptoms and then to encourage them to get a diagnosis. And then Ariana sort of has highlighted some news that came out this week from Esri about the increased risk of developing endometriosis by using tanning beds and sunbathing, and how do we raise awareness perhaps of the dangers of those. So perhaps if you go first, Anna, and then we'll go to Sharon.
That's very interesting. I didn't know that about tanning beds, actually.
It's hot off the press, so you can be excused for not knowing.
Great. Yeah, so endometriosis has come up a lot in branch consultations. So the way we work is that we have our lesson plans, and they are approved by our training director, but we do consult with the branches. They're the ones who are out teaching, and they might have ideas of what they want to see in lessons, and they usually also develop the lesson material. And one thing that we have seen very much recently has been wanting to have more lessons that include endometriosis. And it's actually been quite a task for us to find out where in a lesson plan this belongs, because no teacher's going to ask just for one lesson endometriosis. Maybe they should, but they won't. And so therefore it's our responsibility to find out, well, where can we fit this into? At the moment, it's been mainly focused on social media. I think social media has been a really great resource for these things, because there are a number of really high profile Instagram accounts, for example, that focus just on endometriosis awareness. It's becoming a lot more kind of widespread information, I think. But I do believe that the next step would be to include it more directly into RSHE curriculums. And especially because it is the health part of RSHE, so it is quite important.
Yeah, and it can be so debilitating for women. Sharon, do you want to chip in next?
Yeah, do you know, and that's one of the things that we talk to females about, as periods and pain and things that are not normal, because too many young people don't fully understand their cycle and what's a normal cycle and what's an abnormal cycle, and sometimes severe cramp pain is something that they just need to put up with. So yeah, we do talk to them about endometriosis and about seeking medical attention, not leaving, you know, irregular cycles and pain is something that I have to live with all the days. In relation to sunbeds, I have fairly new to me, just read that today. There's more in that paper. They're also talking about sunscreens also. So I think I would like to do a bit more research into that before actually going out and terrifying everyone that using sunscreen could actually cause endometriosis. I wait to see what the lines to take are from Endometriosis UK. You know, we're not in the business of going out and terrifying people stop one thing to prevent something else. There's a balance there. But yeah, we have real concern about endometriosis and the impact that has in fertility, and how so few young people actually are aware of, seeking medical attention and not putting up with painful irregular cycles.
Yeah. So Adam, I'm guessing that you must see lots of women with endometriosis in clinic.
With respect to endometriosis and also understanding periods, we need to also, dare I say it, be educating our general practitioners, because that's often the first port of call for young women with problems and painful periods. And also just to sort of let everybody know that many of us do adolescent gynecology clinic. So I do, I'm a fertility specialist and my main work is in the fertility clinic, but I also do regular adolescent gynecology clinics in which I see and speak to many young women who have problems with their periods, and endometriosis, of course, could be a cause for many, and it's often left undiagnosed, I think, for at least 7 years, I think is the statistic. And so it's important not only that GPs are aware and are aware of the simple measures that can be taken to help young women who are having problems with their periods, but also know to whom to refer, and to ensure that there is a network now of adolescent gynecology clinics. There is a society, the British Society for Pediatric and Adolescent Gynecology, that a few of us founded about 20 years ago now. So on our website there's a list of all of the specialists throughout the UK who offer specialist advice to young women and adolescent girls about menstrual problems and everything else that they may be concerned about.
I think that's a really good point that you made there, Adam, about educating GPs and making improving their awareness of these things, because I think if you go to your GP and you get fobbed off and sent home that will just take some paracetamol for the period pain or what have you, then you just think, oh, and that's it, and it could be a very long time before you ever go back again, if indeed you do go back, about that problem. And that sort of leads into a question from someone who wishes to remain anonymous, saying, does the engagement you have with midwives, nurses, doctors, etc., about young people having families encourage them to recognise that young people under 30 may have problems with fertility? Young people with problems getting pregnant, especially in their early 20s, might not be taken seriously. And certainly this was something that I came into quite a lot of contact with when I was running Daisy Network for women with premature ovarian failure, and that they'd be repeatedly going with problems but never being really taken seriously. They said, well, it's just because you've come off the pill, you need to keep trying for another 6 months, another 6 months, and all of a sudden it was, several years had gone by. So Adam, if you can
Yeah,
do one first.
Yeah, absolutely. And again, everybody gets everybody gets the nice guidance into their heads that you've got to be trying for a year or 2 years before you're investigated. But that's not true. The reality is, if you've got a problem, if you've got irregular periods or painful periods or an absent cycle, or if as a young man you may have been born with undistended testes, for example, or you may have had problems during puberty as you were growing up, then that entitles you to be referred straight away. And and this again is where we have to educate our colleagues in general practice, who in fairness to them have to deal with a huge range of medical problems. But again, sometimes if you are empowered with the knowledge, and this is what this is all about, fertility education, knowing your body is a skill for life, knowing when things go wrong, then empowers you to actually ensure that you push your GP to refer you. You do not have to wait a year or 2 years or longer. Young people have fertility problems, and young people need to be managed swiftly if they have a problem.
Sharon, do you want to come in on this one? Have you at Fertility Network UK had much interaction with GPs?
Yeah, we do focus on GPs and education, and we go along to any of the GP events that are held GP wide, and we have great engagement with GPs. And as somebody who's not got a clinical background, probably when I first started in this job, I was quite surprised with the lack of understanding and knowledge within the GP community on the specifics in relation to infertility. So yeah, it's something we are very much focused on, is how do we increase the education within GPs. I would say in Scotland, because we've got a Scottish-wide criteria in relation to IVF, we don't come across really that many young people who are not being taken serious by their GPs in Scotland. I couldn't answer that as wholeheartedly in relation to the rest of the UK, and it's probably something we need to do more of, is engaging with GPs UK wide. But yeah, as a non-clinician, I was quite shocked at the lack of knowledge in the GP community, and that's no disrespect to them. They're a great community, but unless you get right into the field of fertility, some of the guidance within all the CCGs in the rest of the UK, it's just a minefield. So thankfully here in Scotland, we've got one simple set criteria, and that makes it easier for the Scottish patients.
Anna, is there anything that you want to come in with on this question?
A lot of the reasons why people are involved in Sexpression is because of negative experience with RSHE or with the healthcare system. And a lot of our members are themselves doctors or like incoming doctors. So I suppose from that perspective, it is something we do like think about. And as I was saying before, like we have members who were kind of pressing us on having more lessons on endometriosis, and a lot of times it comes from personal experience. And I think there is a general need for just a general more like awareness of young people's fertility. And something, this is not that much to do with this question, but just something I also realized with the previous question, a lot of young people in general also have quite a lot of distrust, I think, for their GP or for gynecologists. And I think one thing is also creating more awareness of going to your GP with anything. And a lot of young people won't seek out that medical advice. That's something that we meet. That wasn't really an answer of how to solve that, but more to say that it is something that we do see. I just think that it's a lot of things about information mainly.
Yeah, I think it's a problem that people have been wrestling with for many years. I've been around this sector for about 20 years now, if not more, and trying to get those messages to GPs who are so overwhelmed with people, giving them messages about asthma and heart disease and everything else to sort of get them to focus on this. And I, a little bit like Sharon, I remember going to a big GP primary care event and sort of doing my spiel to someone who was at the stand, and he said, "Oh no, we're not interested in fertility. In fact, where my surgery is, we're trying to stop people from having children, really." And I think it sort of really took the wind out of my sails. I've always remembered that and never quite recovered, because it sort of sat very uneasily with me.
Can I just sorry, just to add as well, something that I remember reading in a study, and now of course I can't remember exactly where that was from. It was doing some research into sexual health inequalities, and it was about it's not just young people not being taken serious, but it's also in general minoritized groups are taken less serious from their GP in general, and that creates this kind of distrust. So I think it's maybe also a communication issue between two groups of not really understanding each other. That a lot of people feel they can't talk to their doctor, which is quite a big issue in general.
Absolutely, in certain cultures, fertility, or the thought that you may be infertile, is so hugely stigmatized that it can be very difficult to seek help. And I think, I remember at some research that the university was being done at De Montfort University with the Southeast Asian community. I sat and had lunch with a woman who was she'd been involved in the study, and she said, "Well, I never knew that it might be my husband. I always just thought it was me." and obviously it turned out that it was her husband, and just that whole, she said, now I feel so stupid, but no one in this, I couldn't tell my mother, even now I know I couldn't tell my mother-in-law it was my husband, because it would still be my fault. And so there's sort of a lot of different education work that can need to be done there with different communities. Now, I want to put you all on the spot, because you've all come up with lots and lots of things that people need to know. And so if you could only give, let's say, a 16 to 18-year-old 3 key messages to do with fertility, what would they be? And I'll go with Anna first, and then we'll go Sharon, and then we'll make Adam go last. And you can agree with each other. They can be the same 3 key ones when we get to Adam. So go on, Anna.
So Adam will get it really easy now. I think the first thing is about, key messages. The first thing would be about understanding sexual and reproductive health is for everyone. It's relevant to everyone. And that is just because of the reasons that I was giving before, that a lot of young people, for a variety of reasons, might not think that it's relevant to their lives, but it's something that will come up all the time. And that is, just affecting a lot of different areas. I think one of them should just be think about contraception. Think about contraception no matter who you're having sex with or not having sex with, and monitor it. And even if you're not the one actively taking the pill, for example, be aware of what contraceptive methods there are out there, what they do. And I think maybe lastly, just understanding family relationships and understanding that a family doesn't have to mean that you're going to have, that you're going to be a cis woman having children with a cis man when you're exactly 27 and having 2 children.
Great. Sharon, what would your top 3 messages be?
I would probably have to put my top 3 would have to be firstly age. My message would be age is a key factor in your fertility, and it declines with age. Sexually transmitted infections can have a lasting impact on your chances of having a family in the future. Oh no, there's lots of others. Probably anabolic steroids. It might increase your performance in sport and boost your muscle mass. However, it can leave you with serious fertility issues.
And so, Adam, what would your top 3 be?
Well, I'd agree with everything that's been said. I mean, age.
You can't have 6.
No, okay. No, I would go with age, but also, understanding your body and general health impacts on your reproductive health. So lifestyle, and I know that's a catchphrase, but if we can do anything to encourage people to understand how to make themselves healthy. And so that's a catch-all, because it's not only healthy living, it's avoiding things like smoking, anabolic steroids and other drugs. So it's stay healthy, and understanding the limitations of human reproduction. I think we say too much. The message in schools is one episode of unprotected sex and you'll have an unwanted child in a sexually transmitted infection, and indeed you may well do so, but at the same time, fertility is fragile, and it declines with age. So I'm sorry, that's a bit of a ramble, trying to encompass everything and avoid the pinpoint of the three major things. But age will always have to be the key thing, but in such a way that it's not frightening.
Yeah. So we have one final question from someone who wishes to remain anonymous. Do you feel that young people with other diseases or underlying problems such as Crohn's disease should be informed of fertility issues associated both with the condition and the medication that is required, along with the education regarding fertility assistance and reproductive health. So I think, Adam, if you go to that one first.
Yes, absolutely. I mean, all chronic medical conditions can have an impact on fertility, both the conditions themselves and the medication that may be used. So yes, I think it's important that again this sort of information is introduced at at an age appropriate time, because these conditions are there for life, and so you need to make a life plan if that's at all possible.
Yeah. Sharon, do you want to come in on this one?
Yeah, that's something that we have recognised within the charity, and as Adam said earlier, this is something that GPs need to take into consideration. But what we've done to try and combat that is we've reached out to the charities, and we've been out to Versus Arthritis to talk to young people. We went to a fairly big event with them because the young people with arthritis are on quite serious medication that you can't take while you're pregnant. They have to change it, but some of the medications they're on actually need at least a year off that medication before they even consider pregnancy. So yeah, we reach out to other partner organisations to try and get that message in there. But also, this is something our GPs also need to take on board when they've got a young person with a chronic condition.
Yeah, I think that's a really good point, Sharon, is those groups, we've done work over the years with them, it's with different breast cancer charities about fertility preservation, and that can be a good way of getting the message to the patients if it's not getting to them through other channels. So Anna, I'm guessing that you've not got much to say on this one, but if I'm wrong, then do chip in.
I think just mirroring the same thing, as in I think it is important, and it's actually something we've talked about on committee. Of course, we also don't believe it's our messaging to give, but we were talking about whose responsibility it is to give this type of messaging, because GPs will not necessarily see it as their area. They will maybe rely on sexual health professionals to relay that messaging, who then will rely on the GP. So I think, again, just possibly clearer communication